Okay. So I believe we're the only board here. So I will call to order this special meeting of the Village of Trumansburg Board of Trustees. Everyone is present with the exception of Trustee Hannon, who is about 1,400 miles to our south. Purpose of this meeting is to go over our annual proposed fire and EMS budgets with the towns with whom we contract. I think for the sake of everyone knowing everyone, we'll go around the room quickly and introduce ourselves. We have some new faces, some more recently, but certainly since the last time we got together last year. I am Warden Hart. I'm the mayor here in the Village of Trumansburg, and I guess we'll go that way and then circle back around.
Ben Darfler, DPW Water Sewer Supervisor.
Ben Carver, EMS Commissioner.
Joel Fay, EMS Administrator. Mike Reynolds, Town of Coder Supervisor.
Marcia Horn, newly appointed trustee, and I am the fire commissioner.
Matthew Taylor, I'm the fire chief.
Justin Boyette, Town of Hector Supervisor.
Caitlin Olson, Town of Ulysses Supervisor.
I'm Victoria Bailey, the treasurer for the village.
Great. Anything that anyone wants to make sure we address, or questions, topics, before we kind of dive into the fire budget first? Since we don't have a written agenda to eyeball. If not, let's dive right into fire. And I will let Marcia and Matt walk us through. And it is on the screen. We also have printouts. I think the totals on that top sheet there.
So typically how I do it is I just run down through the categories. Get my computer to work right. And we can talk at any point. It doesn't matter. Don't think you're interrupting me because you're not. If you have a question, let me know and we'll try to work through it. As you can imagine, budgeting in this kind of an atmosphere of the world is a little bit difficult with escalation of pricing. As fast and rapidly as it's moving, we're trying to think about a budget for a year from now, roughly. So with that, I think, last year and so on and so forth, we've been able to maintain things pretty tight here at the firehouse. Call volume really hasn't exploded, but for any reason, or anything of that nature. I think Vicki has those numbers if you need them. Personnel, that's kind of a village thing, so anything you see, she's got up there all in gold. So line 2, line 3, actually, fire equipment, that's all of our, anything that basically falls in above $500. So that is all of our rescue gear, rope rescue gear, and anything fire-wise that goes above $500 are typically put into that. So I carry that budget line straight through, no increase. Contingency account, no increase. Contractual, no increase. Gas and electric, if you've seen your power bills lately, the CES charges and the demand charges have skyrocketed as part of the green initiative. That's how the state ganders up their money to pay for all those grants that they're going to hand out at election time. And so our bills are starting to climb as well. So you'll see, do you have the percent increases on that one up there?
No, I don't.
No. Okay. I'm not going to try to work percentages in my head, but it's probably around 10%, 12%, which is about the average right now for gas and electric. Training, we've kind of held steady. Most of the fire training in New York State, if you're a member of the fire company, for anybody that hasn't been to one of these meetings yet, is free. New York State provides that at a very minimal cost. Usually you pay for your meals if you go to the academy, and that's what that call covers. Turnout gear and maintenance, this is a bigger jump. We're looking at gear for this year. Gear prices are up about 30%. across the board. So what we used to buy for $2,200 now costs about $3,500. So it is what it is. We try to buy 5 sets of gear a year just to keep the rotation. It has a 10-year life, whether you ever step foot in a fire or even pull it out of the box. At the end of 10 years, you throw it away. We don't have that problem here. We buy when we need it, and we recycle until it's end of life. So, fire prevention, $1,800. We do that every year for the school. So that covers all the supplies and things that we need for that. Station maintenance, I've increased that a little bit. I know there's a lot of hubbub about a new station. I haven't seen anybody show up with a check yet. But I think there's some things that Joel and I have talked about that need to happen in this station over the next year or so to make it more user-friendly and productive for us. So, and the cost of materials has risen, so it's kind of where you see it going up. Small equipment's anything under $500, so I've held that line steady. Physicals, immunizations, we pay for all of the firefighters, fire members' physicals through Guthrie. That number jumps up and down a little bit as we get members, lose members. Some members decide to just go to their doctor. They don't need the full firefighter physical anymore, so they get it covered under insurance through their normal provider. It's much easier for them. So that ebbs and flows. I kind of drove that number down a little bit based on expended from 21 to 22, just to kind of keep things level across the board. Vehicle repair, we have a couple older trucks starting to chew up some dollars. One is slated for replacement here fairly soon, so we're working through that process as well. So insurance, that's kind of the village's thing. Workman's comp as well. I don't negotiate those contracts. Disability insurance, office supplies. It's kind of just a holding point that covers everything that we need to operate the operations of the fire department. Computers, filing cabinets, desks, paper, pens, pencils, copiers, you name it. Fuel. Fuel's skyrocketed, as we know. Luckily, our call volume has not. And so, looking at 21, 22, we kind of ran about 2/3 of the budget. So I kind of dropped that number down a little bit and hedged my bets. Telephones, I don't honestly know where that number comes from. I think it's a contracted negotiation between the village and the telephone service providers. So I'd have put 2,900 in. We use 1,750, 1,795. I put it back to 1,900. Hose ladder and testing, those requirements have increased over the years and the cost has gone along with it. That's why you see a bump from there. We actually ran over budget about $4,000 in 21, 22, so that 15,000 kind of brings us back up to level. Pagers and gear. So we put in for a grant last year as a regional grant with the city of Ithaca and the Enfield Fire Company. So we're waiting here on that. Hopefully by September, October, we'll have an answer from FEMA on that grant. Enfield actually owns the grant. We're just a tag onto it, as is Ithaca. It's around $600,000, I think. Replaces all of our portables except for a few that don't qualify for replacement, and our mobiles in the trucks. As you can imagine, a portable, I just got a price on one the other day to replace some, because they don't replace officers' portables, they only replace one per truck seat. So there's 7 officers, I have 2 radios in my command truck, so that's 8 radios that we have to buy out of pocket. They're about $3,500 a piece. So we've hedged that down in the reserve budget, so it's not like there's no money around. This money here, the $3,000, pays our pagers, buys small stuff that we might have to repair or keep radios running, like batteries or mics or antennas and things of that nature. Legal is if I ever need legal. Retirement, FICA Med, hospital, medical, all that is village expense for people to administer the budget and things of that nature. And then lease principal and lease interest is on 1841. I believe that is done in January.
July of next year.
What is it?
July.
July next year, yes. So that will come off next year. That'll be the last payment that you see there. So that will actually be zero when we're talking at this time next year. Any questions on that? I went through it pretty quick, but let me know. Any questions? Comments, concerns?
My sheet cut off those totals. So proposed is 4, 5, 6, 7, 7, 6.
So it's actually a decrease from 22,000.
Now 9,000.
I had a question about, so for 2021, 2022, I'm looking at proposed versus adopted. You know, the adopted was roughly 468,000, expended was 415. Is the balance going into reserves? What happens to that balance, unspent balance?
So for fire and EMS, because they're part of our general fund, anytime there's an overage or an underage, it's just absorbed into the fund.
So it's just absorbed into the village?
And so if we'll get to it with EMS in a second, if there's an overage, the village pays, when we're over budget, the village has to pay it, and we don't have a way to recoup that from the towns for that contract year.
Well, I'd say you're doing a pretty good job. There's only been 1 year that's been an overage.
Fire, we've always been very close to fire, because there's no payroll associated with it.
Well, 50,000. Still fairly sizable.
Yeah.
But at the end of the day, I could lose 1,000 foot of hose and 50 grand up pretty quick.
Oh, I don't doubt, no, I think, it's not a criticism, it's just,
No, I know.
it's just a wonder of where that, the balance goes.
We've always tried to keep it fairly close. So 18, 19, we were a few thousand over. 19, 20, we were under. Fire is always historically. There was something in 21, 22 though.
Well, it was really the lack of resources. You go to order something, you couldn't get it. So it was like,
It's a great way to save money.
No,
Yeah.
there was something specific I remember in 21, 22, because if you look at the adopted budgets, went from 470, 467, 480. I don't remember that we actually bumped it to 549. There was something that happened. You've got a personnel line in there.
No, I think I put a number in there. I typed too much. I have to look for it.
Yeah. So if you look at 21, 22 adopted budget, the personal line is 89,000, so that's a typo.
Yeah, I'm sure that, I don't know how that
So
happened, but I will.
So your 549 number at the bottom there, 21, 22,
Is wrong.
is
not
not
right.
right.
yeah, mine says 468.10, 21, 22.
That's probably,
I see that as the adopted.
Yes.
yeah.
So we're still under, but not to the tune of,
Almost
It's
50,000.
about 53,000.
Yeah. No, I understand the value to the village for keeping it in the general fund. I just wondered if the value to the fire company would be actually to have that as a stockpile for them. I
well, the
mean,
fire company is its own entity.
Right,
So we
but,
cannot direct taxpayer funds at the fire companies per se.
okay.
All of the funds have to be directed to village equipment. The fire company has their own books.
And the building is owned by the fire company?
Village
No,
owns
village
everything.
owns it.
Village owns everything except the people.
I'll tell you what, the fire company owns the table, chairs, and the stuff you see in that kitchen.
I can just see that
That's it.
I mean, just as a contractual outsider, that money could be well put towards a building fund on an annual basis.
Potentially.
Yeah, or even for renovations for this one, depending on how long it takes a congressman to bankroll a new fire hall.
They're fire related.
Do we want to talk reserves, or they're pretty much stagnant? So you see a huge decrease in reserves on the fire equipment, 60,000. Is this year's adopted budget back to 15,000. That was So when we decided to put a project together for rescue tools, honestly, we didn't have the thought of a turnout like we did. So being that I tried to plan a little bit ahead, I said, well, let's take the money from the ladder. That money has actually been in the budget for roughly 7 years. We paid the ladder lease with that money. We bumped it around. It was in fire radios this year, being last year, because that's the money that's going to buy the balance of the radios that the grant won't fund. And then we moved that money into fire equipment to help with the rescue tool fund if for some reason we came up short. So it's back to 15,000. And then probably, I'm guessing next year, honestly, I'm not going to put up any money in that because I think it's pretty well stacked at this point. We just let it run for a while. So fire radios back to 2,000. Firehouse buildings 25,000. We've been carrying that line for quite a while. And then apparatus, I think that's the top number that we're going to stick with for quite a while. 175.
So a couple of years ago, when Ben Darfler was the fire commissioner, we reworked the replacement cycle sheet that we have, which I don't, did we print that?
I did not.
So we have a spreadsheet which we can certainly share if you're interested, that looks at a desired replacement cycle for all of the fire department vehicles, and I think we went out to 2040 or 42, 2040. And so with 175 a year going in, we'll be able to fund replacement cycles out at least until 2040. I think it's worth probably reviewing this spreadsheet every 3 to 5 years just to get up-to-date costs on some of that equipment. The ladder truck, which is in the building, I think was $775 when we purchased it. A similar ladder truck today would be well over $1 million. I have no intention, as long as I'm mayor, I have no intention of buying used vehicles. Our district is too large. We need reliable equipment, we need reliable vehicles, so fortunately we have the ability to save for it. The ladder truck itself was actually leased, super low interest rate. I think what was it, a 7-year lease?
Something like that.
The last one?
The ladder truck was a 7-year lease, I think.
Yeah.
Something like that. I don't anticipate that lease deals will be quite as good in the future as they were a few years ago. So that's why we decided to make sure that we had enough money set aside to absorb the costs. And of course, we get a decent price because there is a significant used market for fire trucks. We get a decent price when we turn around and sell these, as long as they're not too old. So 20 years is kind of the typical replacement cycle we try to hit. Some of them we've stretched to 22 years, but in general, that 20-year time frame is where we try to replace a vehicle.
So on that, I do have the real document here.
Yeah, Ben's got it up over here.
So in 23, 24, the budget that we're talking is replacement of 1802, I believe. We'll see if I can open it. So that's, we should have in our reserves around 617, expecting to spend around 7 and change. Sales on the current truck, we figured 75,000, might be a little more, might be a little less now. So that, that kind of leaves us with 157,000 going into 24-25 budget. And then the next big vehicle purchase is until 28, 29, which I believe is 1804. And that's 810 is what we're figuring. So we'll still be liquid at that point, pretty good. So.
Now, fair warning, because we do have the one vehicle lease dropping off next year, I am probably going to suggest that we take that dollar number and put it into vehicle reserve, rather than seeing a decrease in the budget next year, plus any other expenditures that we might need. But the year-to-year expenditures don't change a bunch unless there's a specific equipment need, like the turnout gear a couple years ago, or radios, or what have you. But I'd much rather keep the budget flat next year if we can, and have additional cash going to one of these reserves than reduce the budget as much as that might feel nice, and then fast forward 7 or 8 years and have to have an increase because vehicle costs are so much higher. Ulysses, Covert, and Hector, you all know this, but just for the record, and in case anyone does watch this video, the fire district is what, 56 square miles?
Yes.
56 square miles. It's a relatively large fire protection district. Shoreline, what shoreline?
13 miles.
13 miles of shoreline. Technically, we're responsible for all of that shoreline and the lake
Out to the middle.
out to the center line. It's not a discussion, well, I'm happy to have a conversation about it. It's not a discussion that's ready for prime time, but we have had conversations for a long time about the need for a watercraft of some type capable of putting out fires on the lake. I haven't figured out exactly, I have figured out how to pay for it. I haven't convinced the people who are going to pay for it to do it just yet. But we need a location for the boat, so that has to come first. And we may be able to work on that in the next couple of years. But there's a lot of property, particularly in Ulysses and Covert, on the water where you cannot get a tanker truck. 2, and I think that's a code issue that I know Ulysses has looked into about making sure that driveways are accessible to fire apparatus. But certainly the ones that are already there where you can't get there except by water. That's an issue. And then of course there's the water rescue side. There are no, Union Springs has one.
I'd say it's getting about 2.
Yeah, they're not in the water.
Their new one's gonna be done.
So at least at this time, there's only one municipal or emergency watercraft on the entire lake. The Sheriff's Department doesn't have one, State Police doesn't have one, Coast Guard doesn't have one anymore. And that's all the way over in Union Springs, so that's a long way. Lansing wouldn't be bad. They do currently have a boat, but they don't dock it. They have to trailer it down. It sounds like they're getting a heck of a new boat though.
After the new boat, from what I understand.
Good for Lansing.
Am I remembering, Chief, I thought I read in the news at some point this summer that Trumansburg Fire helped with a sale of the capsize? So how did you do that?
We stand on shore and watch.
That would be, I'd be cheering from the sidelines too. Damn harbor.
That's the issue that we have, right? Is if a call comes into the lake and they go, I can see Teganic Point. And they tell the dispatcher that, they tone us out. We go down there and go, yep, there's the boat. You better bring us some help. And then we try to commandeer a boat or,
Okay.
you know, and the lake in the summertime isn't quite as bad because there's plenty of boats
Right.
around and people are at their cottages. But you'd be surprised how many boats are on the lake in January, coming in and out of Teganic, either fishing or hunting, or basically that's it. There's nobody out there water skiing, obviously, but there is people out on the lake even in the wintertime. And, you know, if you take a ride down the water sometime and just look at the houses, I think, you know, Lindsay Hart and I have had this conversation that the 1,200 square foot shacks are no longer there. They've been demoed, and then the 4,000 square foot mansion has been replaced into it. So the size of the properties on the shoreline that are inaccessible by most of our vehicles are immense and they're huge and they're stacked right next to each other. So, you know, one fire leads to another, and leads to another, and leads to another. That's what keeps me up at night. It's not really, you know, water rescue and stuff of that nature that's out there. It's always been there. The houses are bigger, they're more populated, they're more used now, and the access isn't any better from the highway. So, you know, I think a fireboat of some nature is probably warranted at some point. That's the discussion we've been having lately, is how big, where, what, you know, what's the, how do we pay for it at the end of the day? Because fireboats aren't cheap. We're not talking $20,000 Chris Crafts. We're talking $300,000 months in welded aluminum boats that are made for firefighting, get in close to water, they can moor up, they got drop decks on them to pull people in, things of that nature, and then they got to be accessible year round, because it's no good if it sits in a trailer in the station and it's a half an hour to get down the road in a snowstorm to get out there to get some duck hunter that's capsized. So
There have been several occasions where fire department or fire company members have used their own personal boat for certain situations. As Chief said, in the summer it's easy. Half of Ithaca Fire Department owns a boat, and they're usually on the lake in the summer, so if there's a problem, you can probably find someone to help.
Yeah.
But that's relying on a whole lot of luck in those circumstances.
Okay.
Anything else fire? So if we flip to the last page, the conversation to have with you all from the towns is, we have our typical, the top part of that last page is EMS, so we'll ignore that for the moment. And then all of the rest is fire. We have, as you know, historically always broken apart or split up our fire budget based on a 3-year rolling average of call volume. We were intending, I believe last year, to move to a model which breaks up the fire budget with the concept of if there were no calls at all, no fires, no accidents, the kind of the utopian moment, no fires, no car accidents, nobody gets hurt, no trip and falls, no trees down on the road, no cats in trees. We would still have a cost to have a fire department. What is that number? What is that stagnant fixed cost? Versus what is the variable cost borne by having a certain number of calls? So the variable piece is kind of obvious. It's gas, primarily. It's some of your equipment, wear and tear, if you can kind of figure a value on that. But fire in particular, almost all of your, so it's a percentage.
I think it's 75 is fixed.
So call it 75% of the budget is a cost that we have to have in order to have a fire department. So conceptually, the idea that was put together was, should we split that portion up on something based other than call volume? Because again, if there wasn't a call, we would have these costs anyway. And a lot of places in the town, Ithaca does it, a lot of places have moved towards a property assessment value model. Because essentially, specifically with respect to fire, not so much with car accidents and the like, but specifically with fire, it is a form of cost of insurance against total loss of a building. And so we developed this model, primarily it was Ben Darfler at the time, developed this model where we said, okay, we're going to split the fixed costs up between the municipalities by an assessment value, and then we're going to split the quote-unquote variable portion strictly by call volume, as we always have. That does change, as you can see, does change the charge to the towns. Ulysses sees an increase of about 15%. Covert gets the biggest change, almost a third, 35%. And Hector goes up by almost 18%, and the village sees a decrease. We were asked last year to postpone the adoption of this new model for at least a year, and we agreed, and here we are, at least a year later, deciding whether to begin to implement this. If we do move to implement it, we would recommend a phased-in approach, so the towns that see the increases don't get hit all at once in January of '23. That's the bottom spreadsheet. We would recommend a 5-year phased-in approach, moving in that direction of this hybrid fixed and variable call volume approach. The village has not unilaterally decided that this is the moment, but we are interested in moving towards something like this. And quite frankly, I mean, yes, you see a big decrease for the village. Quite frankly, if the village wasn't contracting with the 3 towns to provide fire, we would do things differently. We're only 1.25 miles square. We wouldn't be talking about boats. We wouldn't have, as many apparatus as we currently do. I wouldn't be begging DC for money for an $8 million fire hall. I mean, there's a lot of things that would be different if we were purely a village fire department, but we're not. We're 56 square miles, so the question becomes, under a model like this, Currently, the village taxpayer is bearing a larger burden for the maintenance of the department than they would if it was purely a village department. I am also, however, sensitive to the good neighbor approach we've always had, so it's okay that we've been doing it the way we've been doing it, but I think that it's a better idea to move in this direction of a different model, a different way to break apart how we spend the budget. I don't anticipate our fire protection district growing, unlike EMS, which we'll get to in a few minutes. I don't see there being other municipalities that become a part of this. It's really just the four of us, the village and the 3 towns, and so it's just a matter of what's most equitable. There's a lot of property value in the town, particularly on the lake. Covert's seeing a huge increase in that over the last few years, and I would expect that to continue going forward.
It's gonna get worse.
Yeah.
It's gonna get worse.
So I'm opening it up to, comments, opinions, preferences in terms of time frame, 5-year phase-in, 7-year phase-in, can we wait another year? Heck with it, let's start now, kind of where you all are at. Don't all cheer for paying more all at once.
Yeah, nobody volunteers for that, you know.
No.
Because I don't. But this 5-year, the bottom line's here, so I would be like 50,000 this year, or 23, 24, or no?
Yeah, that's right.
What's that number?
Yeah.
50,000 on top of it, what, or is that, yeah,
This would be the breakdown for this year.
50,000, all right, I can.
So 2 boxes up, Mike, the 3-year call volume. If we make no change, your bill for 23 is going to be 47.
All right, hey, I can digest that.
If we move in the direction of the
$3,000 increase, if you really want to go with this route, I guess, I can handle 3,000. I'll probably get yelled by the rest of my board, but anyway.
I know what boards are for.
Well, yeah, that's right, it'll show you pay. But I'd be able to, I don't, Caitlin, what do you think? Or you're,
Well, I love getting to spend more money, personally. So I had a question. So I just wanted to remember that if I recall correctly, the way the split fixed cost was going to be, it was 85% assessment and 15% variable, is that correct? Still
I think
that?
it's a little closer to 75-25,
Okay,
but yeah, it does get changed every year based on the actual budget numbers, but it tends to be closer to 75-25.
okay. That was what I remembered from a previous year. Okay.
I think I seem to remember those numbers too. I think it's just fluctuated over time.
Okay. And these, of course, the 5-year phase approach, this is, for all the subsequent years, this will all vary also. These aren't the fixed numbers, right? Based
Right.
on as budgets change. Just wanted to confirm that.
Yeah.
I actually don't have a big problem with moving to a partially assessment-based model. I think there are a lot of ways the numbers could be parsed. I would prefer to start an increase in the year when I've had my assessment happen, which did happen this year. It's an easier time to start to bear those. So, I think the village has all the cards, so to speak, in this, and I'm less concerned, frankly, about fire overtime than I am EMS. So EMS is where I'm concerned. I have a lot of Ulysses residents who serve in the fire department. I'm very supportive of the fire department, so I'm not gonna be taking a big fight over this one. So if you go to the 5-year, 7-year, 10-year, 14-year spread.
100 years. Yeah, I was actually cognizant of the assessment increase piece too. So they went live July or June or July, so January is going to be your first go with the new assessments. We don't get ours till next June. We don't get to use them until next June, so.
you won't be here so much here.
Right.
I'm not too concerned about the addition. I can go on and I feel comfortable with the 5-year approach.
Okay. Good. Anything else on fire before we get to the fun stuff that Caitlin just alluded to? Okay, so EMS, before we go through the budget line by line, let's just look at history real quick. Speaking of overages.
Thank you, everyone.
Thank you,
Thanks,
Chief.
man.
You missed the fun part of the meeting.
That's exactly what he's trying to do.
I think that was the plan, but I'll say it. Good luck, Bill.
He is a smart man.
Thanks, Matt.
Need you to come push you out, just give me a call.
So I know Caitlin's heard it. If y'all haven't heard my soapbox on EMS, I'll spare you the long version, but I've had multiple conversations with multiple state legislators, and those conversations are ongoing and continuing, and I'm hammering on anyone who will hold still long enough for me to tell them that EMS is not rescue service, and it's not emergency service, it's healthcare. It is medicine, it is that ambulance, those ambulances are mobile emergency rooms, and our paramedics are medical professionals, and Albany needs, and since we are politicians at least some of the time, I will be calling on you at some point to call your state reps, your assembly folks and your senators, because there will be an EMS legislative packet introduced in the next legislative session. It'll have 3 parts to it, most likely. The first part, many upstate municipalities will not like. It will mandate EMS as an essential service that must be provided or contracted for. The second piece is it will increase Medicaid reimbursement rates, which frankly is a cash giveaway to the for-profit sector more than anything else, because your Medicaid calls, your Medicaid patients tend to cluster in urban areas where there are for-profit agencies. And the third piece is the huge piece. The third piece would establish a CHIPS-style funding model from the state to help subsidize municipal and not-for-profit EMS services. That part of the bill was introduced in the last legislative session, did garner a lot of support. Some of you might know of Senator Michelle Hinchy from the Albany area. She was highly supportive of it. But it got a lot of pushback from some of the, I was about to say usual suspects, but some unlikely folks opposed it as well. So the hope is that by packaging it with these other things, which are kind of pet issues for some other legislators, they can play the house of cards game and maybe get a bill put together that can pass. That would be a huge win, because there are about 2 million EMS calls statewide every year. If we attach an easy number, round numbers for a Thursday evening of $1,000 per call, we're talking about $2 billion in cost per year. About half of those are private sector. So we're now talking about $1 billion to municipalities and not-for-profits, which is a big number, except that the state budget is $212 billion. So for 0.5% of the state's budget, our governor, who was a member of a town board in upstate New York, can unilaterally take care of the EMS funding problem statewide. So that's our pitch to her, and hopefully she'll bite so we can get some movement on that. In the meantime, we go back to 18-19, you'll see that our budget versus actual number, we were 13.6% over budget. The village ate that difference. 1920, we were 7% over budget. 2021, we were 7.8% over budget. And this year, ending May 31st, 21-22, was the first year since the beginning of time that we actually managed to be slightly under budget, to 2.6%. Annual year-over-year increases, 18-19 to 19-20 was 9.7%. The following year was 12% budget increase. And then we had 2 consecutive years of a 7% budget increase. And this year we're proposing a 7.5% budget increase. I don't like the increase, but I like the fact that it's 7.5, because if I switch hats for a second, my Tompkins Health Consortium hat, medical claims trending. If you don't know what that is, it'll take me 3 hours to explain. But medical claims trending over the last 5 years in central New York has around about 8%. So it's not surprising, given the EMS's healthcare argument, that we're very close to that medical cost year-over-year increase that the entire healthcare industry is experiencing. so with that, I'll turn it over to Ben and Joel to kind of go through the line by line. And then there's a couple other issues kind of more broadly about EMS that we'll circle back to and talk about again once you answer any questions that you have about the line by line budget, once we've gone through it.
Very good. Thanks, Brendan. So I'll just go through kind of the highlights, and then any questions, I'll turn it over to Joel, the details. So the first change is that first line there. And the big, I think there's a note on everyone's sheet that says EMS clerk. So the big changes there are that we've created a contingency line, or I think we had a chronically underfunded contingency line for overtime previously, and that was part of the sort of volatility that Roden was just talking about. So we've increased the funding for that contingency for overtime, and we've also added money for an EMS clerk. And the reasoning there is really fairly simple, which is that we rely on the office staff, I think, a little too much. We also rely on Joel or whoever the EMS administrator is to do, I think, maybe too much of what would be considered administrative work. And then more than that, we also sort of pass along those duties to the various EMS staff. So while they're not doing calls, they're doing various office tasks. And beyond that, the idea is if we had a clerk, which is something that we do, our village police department has a dedicated clerk for a much smaller department in terms of overall budget. But if we had one in the EMS department in particular, that person would be tasked sort of out of the gate with investigating what in-house billing looks like, and a number of these other services that we might be able to take on, but we don't have the capacity at this point even really to look into those things sincerely. So the hope is that we could take those in-house, and that might actually generate revenue for us. Obviously, it's a big question mark, but that's the reasoning there. Moving down, the next change is EMS Supplies, which is just a little bit past halfway. It's 4540.47. That's up really just as a product of EMS Supplies getting more expensive. There's no complicated explanation there. You can see the actual number is higher than anticipated, so we're just matching what's there. The next, if you skip a couple lines down to state retirement, FICA Medicare, disability insurance, and hospital medical, those are really numbers that we don't have a lot of control over. Those are just insurance numbers, so those are fluctuating, but they're really sort of given to us more than anything else. The next change is the EMS Vehicle Reserve. This is actually something that when Joel started, well, actually, it wasn't when Joel started, it was more recently than that. It was maybe a month ago that we sat down and looked at the replacement plans for all the schedules for the ambulances. We initially started this because we were actually thinking about a fly car, because as our call volumes have increased, we really lack surge capacity. And Joel saw that immediately after starting and said, I have a car. Let's equip my car, and I'll be able to take these on, right? We have a lot of volunteers that live in the village who might be willing to go, and that has been really immensely successful in terms of covering second calls in the district. It's also, I think, something that I wasn't expecting that probably Joel foresaw immediately that was just hidden to me, was that it also allows our response time to be significantly faster if, for instance, the crew is coming back from CMC. Joel can be to a call, in covert, within 3 or 4 minutes, 5 minutes maybe, where that ambulance might take substantially longer. So in terms of just, there's no revenue generated there. Obviously, the fly car is not transporting, but it does allow life-saving or potentially life-saving care to be applied faster. So this $35,000, this bump, does not take the fly car into account. So this is actually just adjusting so that we can maintain our current 10-year replacement plan of ambulances. Unfortunately, ambulances have gone up. So one of the questions for you all is if we want this year to increase that number to include a fly car. If we want to wait, this is something that we could stagger similar to the fire. I mean, we can take the strategic approach and delay that a little bit. But I wanted to turn that back to you. But I won't do that just yet because there's another line where a similar thing applies. So the 2 lines above that, EMS maintenance agreements and EMS equipment. While we were looking through the ambulance replacement plans, we sort of had an aha moment that was more like no shit moment. That was, we have auto pulses, we have substantially, well, we have important and expensive equipment in the ambulances that also has to be replaced on a regular schedule because it's mandated. And we are coming to the end of the life, the usable life of those pieces of equipment. And we have not historically budgeted for new equipment. So that line, if it goes into the maintenance agreement line, it would go up to 30,000. Well, let me just actually simplify that. So one of those lines needs to go up by 15,000 over the course of the next couple of years. So just to recap, for the EMS Vehicle Reserve, we will need to raise that line to about 45,000. I believe it was 47.5.
45.7.
Okay.
No, I'm sorry, you're right. In 2028, it would be 47.5.
And then the line above will need to get to 20,000. Again, these things can be phased in, which I think would be the preference. This, as it's written, is probably the first kind of baby step in that direction. But I kind of wanted to get the read of this group to see how fast, how slow we do that. I think, well, I'll leave it there actually. I'll just open it up. I'd love feedback and sort of the approach there.
I was wondering what, and you might not have the numbers right at hand, what are the balances in these reserves now? You know?
Yep, I do.
Do you have the replacement? So ambulance is 122,449. And I believe the equipment is 12,000. Oh, actually, Vicki, would you check the equipment one? I'm not sure that this is right. I'd also be happy to share these,
Okay.
the
Hold on.
replacement plans.
I would love to see the replacement plan. I remember looking at the fire one in particular, but I don't remember the EMS one.
Well, this one has-
They're very rough. They need a little more cleaning up.
They haven't been shared, so you're
Okay,
you're
then I'm not,
you're
then I
you're
really am
forgetting.
not missing something.
No, the sort of timing here is that Joel and I did this and I immediately got COVID. And I woke up from COVID
Oh,
about 2 days ago, so here we are.
And you want to know what balances are?
I was just
Yeah,
asking.
for
Okay, rough idea.
ambulance and equipment reserves.
Okay.
But I can grab for you at the end of the meeting. I don't need to
Oh,
hijack the short part. So my initial take was, it's already for us, it's gonna be a sizable percentage increase. And I wondered about the fly car from what you were talking about at TCOG and what we talked about. What's the likelihood there's a fly car coming from Tompkins County at any point?
So there's a couple of things, and I was gonna wait till the end, but I think as part of this conversation of how much should we be planning to absorb. So I'm sure Covert and Hector is aware of this, but I don't know that you're necessarily aware of the extent of it. I know that Schuyler County obviously is going to a countywide ambulance service because of issues between the county and Schuyler Ambulance. There's some stuff going on in Tompkins County. So in a nutshell, I mentioned that the fire protection district is 56 square miles. Our ambulance district that we cover for Covert, Hector, and Mac and Ulysses is about 112 square miles. We are, and I don't think we have the map. I love that map. We should have it posted, plastered everywhere.
Always on the wall.
Our map of call response, including mutual aid, covers about 400 square miles. So we're responding basically from north of Romulus into the city of Ithaca. We took 11 calls in the month of July in the city of Ithaca. I had a conversation with the supervisor from the town of Enfield yesterday. They are looking for better response in their area. We've taken 2 calls out there in the last couple of weeks, I believe. So there's tremendous strain on the network due to call volume and call type. In particular to the south, Bangs, I had a conversation with someone from Bangs administration the other night. they have, like everyone, they have staffing issues, but they're also seeing some specific stresses on their ability to respond to calls because of everything we're reading in the papers with respect to law enforcement in the city of Ithaca. So, for example, if there is a drug overdose, they cannot treat the patient until a police officer arrives by best practice, because they don't know what that situation looks like. When you have those kinds of situations, if those ambulances are tied up for a long period of time, then it's either Dryden or Trumansburg that's going to pick up the additional calls. And Dryden is certainly responding into the city with some regularity. Dryden, by the way, added a third full-time ambulance crew last year. They were running 2 for a number of years. We're at that point where we have to figure out, are we able to add a second full-time ambulance, and if we do, who's going to pay for it? I don't find, and actually the conversation with Enfield was helpful, because it made me realize that, okay, if we are put in a situation where we have to absorb territory, I don't want to use this budget model to do it. I want to kind of protect Covert Hector and Ulysses and the village, and if we have, because we are operating as tight as it gets, we're operating with 1 full-time crew and our administrator taking all the second calls, right? As soon as you add a second full-time crew, payroll, your payroll is 747,141, that's for 1 full-time crew. You add a second full-time crew, you double that number. So I know Joel's had conversations with CMC, because part of this network stress affects their ability to transport patients from hospital to hospital. They've historically always utilized bangs for that. Well, bangs can't manage that, or at this time is having trouble with that, but maybe we're a backup. Enfield is going to be an interesting conversation, because they're not going to want to pay $750,000 for some park an ambulance there. So that's kind of the backdrop to all this. There's of course the other ancillary pieces and the contentious pieces once we start, injecting law enforcement into the conversation, particularly in Tompkins County. And so Tompkins County's Director of Emergency Response is looking at, and we are actually going to pitch it to the legislature in September, is looking at starting up not an ambulance service per se, because the startup costs are so high, but if they can have a paramedic, we're calling it medical rapid response model, a fly car model with paramedics, so that instead of Trumansburg offering mutual aid to bangs, Tompkins County can offer mutual aid to bangs long enough for an ambulance to get to the scene to transport that patient. That way, T-Burg EMS is not sitting at CMC on call to take bangs as next call, which means our response time to Actor and Covert is 15 minutes longer. Or if we're in the city, if that call in the city of Ithaca results in a transport, then our entire district is without coverage, except for Joel, if he's awake at 2:30 in the morning, to take that next call. That's kind of where we're at. And so a discussion for this group, although in the past we've had arguments about, it's a village department, and blah, 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 I think this is a collaborative decision of how do we want to prepare for whatever that next step looks like. Is it, we're happy to staff a second ambulance if you, municipality X, are willing to pay for all of it? Is it, budgeting for a fly car so we can do some of our own medical rapid response, knowing that that means everyone else is going to know we have that capability, which means we're going to get spread. And how do we want to position ourselves? Because if we had the map, geographically, we just happen to luck into the perfect spot in between the 2 lakes. We're it. If we don't take the call, no one else is. So how do we? This is one of those things that I don't want to unilaterally say, we're going to do this and we're going to share the cost. I think there's some strategy to be had with respect to our services are going to expand over the next decade. How do we want to manage that? So we're fair to the municipalities that we've been working with for 50 years. While not saying no to the next municipality when they need help. And I'll be quiet, but I'm very interested in, at least for the 3 of you, not speaking for your boards necessarily,
can I kind of share at least my view why a fly car is an important piece?
Oh, I don't disagree with the flag car, the idea. I was actually going to suggest that I thought it was really great how the fire department worked with local groups to get the jaws of life, and it was paid for outside the fire budget, and I was wondering if a flag car, I think there's a great case to be made on, is it possible to do a fundraiser funded outside the budget? That would be you don't need to sell me on the idea of a flag car, I think it's a great idea, it's just how to pay for it. I think for me it's a bigger issue.
There is the map that changed the conversation in Albany, by the way. So that is, when is that, two? When was that?
2021.
May of 22? Who's this year?
Ben just said.
The file name says 2021 on it, 2020 to 21.
So that's through the end of May, that's from
Right,
COVID.
yeah, it's
So
our budget.
2020, we should rerun that. For 21, 22.
Because we have some, we were in Seneca Falls and in the city of Watkins Glen. We were in Seneca Falls 3 weeks ago, I think. That's a haul.
So Caitlin, to answer your question though, the problem is really just that we can't fundraise. So the company can fundraise and then they own the jaws of life. But we don't have like an equivalent arm of the EMS. It's something that we've looked into.
I would very much support helping fund that, funding setting
Yeah,
up
get that
a
started.
wing of that, because I'm watching what's happening in the area of the state that I used to live in. I used to live in western New York in the Orleans County area, and their ambulance is all volunteer, and it's not supported by a single municipality. No taxpayer dollars go to it, and COVID's they're collapsing. They have pitched their case to every municipal board they can get in front of. Nobody will fund them, they are gonna disappear. And but it's also, they've existed this long simply because people will open their pocketbooks because they understand. And so, I think if we're looking at a 8 to 10% increase on a year-to-year basis, it's gonna be really hard to absorb that just from the taxpayers. And having a friends of ambulance group to help subsidize might be a way to do it.
Well, I'm actually going to drag you probably to one of these conversations with these legislators, because
Yeah.
that map and that reality is what is actually making some movement towards throw some money into municipalities. Because 8% a year,
It's not sustainable.
you double in 9 years.
That was a tax cap.
Chautauqua County had to go to a countywide service because they lost a couple of volunteer agencies. Is it Broome or Tioga is also looking at
Evaluating it now.
looking into, do they need to stand up a countywide service? Tompkins is fortunate because we have Trumansburg, we have Dryden, we have Banks. So the county is in a good position where they don't have to stand up a service, but it's time for them to do something. And I really want to see that map for 21, 22.
Yeah, it should be easier now. That took many, many hours of data, just slog. But I believe Joel and I have worked out the kinks in the address input for EMS charts. So it should actually be pretty easy.
I'm sorry? Did you say that?
Just letting you know, I might be able to share a link and get it. It's gonna be our current.
Now, most of those pins have been slightly altered, so you can't figure out whose house it is, but you get the idea. The black line is obviously the contracted district. So we get Ulysses Covert, and a whole lot of pins outside of that.
To get back to your point though, Gordon, about what's the strategy as more groups need, more areas need coverage and are gonna want it. I think at least in my perception, the real strain is that when it's just one. But it's one that requires a second rig, right? Scaling at that slow of a rate is where the real budgeting problems come in. It's almost if you have to pick up a couple almost simultaneously and capture them and say, and Bill, we'd be delighted to take you, provided you can sell this to, and we could sell this to Philip, yeah. Because it's that one-off that expands and stretches too far. But if there was a scalable approach that provided enough geographical area to support the second rig, then that seems to be a lot more doable and manageable.
Yeah, it's really population density. But yeah, there's like a threshold of about 1,000 calls where we're on the brink right now of like, if our call volume continues to increase, just internally we'll need a fly car on our own within the next couple of years, at least. We'll need something, we'll need somewhere.
We have it over there.
Right, that's a good.
I'm bearing the cost.
Yeah. But we're sort of right on that cusp, and if you add 200 calls,
Right.
you're exactly right.
Yeah.
We're just, you can't possibly ask someone to fund $1 million with 200 calls, it's insane.
No, and I get that it's population-based, but it's also spatially a huge issue. You add another 200 miles of coverage in the service area, or in the mutual aid area, and you have to have another vehicle, otherwise you're gonna, 20 minutes for a patient is, I would imagine, a really long time. So,
Even with the second vehicle, you could still find yourself
oh, absolutely,
without.
yeah.
I mean, we're fortunate, it's a fortunate and unfortunate situation at the same time. We're fortunate to have, a great EMS department with great personnel and not have to worry about it going away tomorrow like a lot of places with volunteer companies do. It's unfortunate that because we are kind of the only game in town in this area, at least with some reliability, that additional strain and pull on this department is just never going to go away.
So, for the moment, we can leave this. My preference would be to increase at least EMS equipment by 5,000 at minimum.
So increase from 5,000 from what's currently posted?
Yeah, increase to 10,000 from
Okay.
5,000.
So that would what, toward the fly car, or what's that gonna go toward?
So that is, remind me, Joel, it's auto pulse stretchers. Was it one other thing?
Yeah, so we have a series, long story short, we found a little bit of a kink in the system. We have some equipment that's near the end of its service life in 2023 that is going to be a little challenging to replace. And when you add the expenditures of them all, if you're going to replace them in all the vehicles, we're close to $200,000. So we're hopefully going to be able to evaluate leasing to own for this round, but we're trying to plan for future so that way we don't run into this again, and that way it puts us onto a good, healthy replacement schedule.
But what are the pieces of equipment?
It's auto pulse, our stretcher, and it's a load system, our cardiac monitor, and our stair chair. And they're all, the difficulty about them is they are all FDA pieces of equipment, and so there's a lot of mandates upon them.
So are we gonna add, do you wanna add the 20 grand, or you wanna add the additional?
No, we're not doing anything yet.
Okay.
And now we're all distracted.
I know,
This is
I deeply apologize.
Please resume your regular.
It was worth it for the map. It was something really like a different movie.
So we're at 7.5, what's the 5,000 maybe?
Oh, in terms of the increase?
Yeah.
I'm not even sure it would impact the percent.
6.
Yeah, so
I don't think it would be much at all.
I guess. In the scope of $1 million, 5,000 is,
Maximum.
right. I mean, obviously it adds up, but. Vicki, can you see what it would be with the 5,000 is, what the overall increase is?
12,000 is 1%, so 5 is going to be 45 basis points, so it's going to be 7.9.
Where are we adding the $5,000?
Equipment.
Reserve.
He wants to know what it changes the contract?
What's the percent increase of this over the last, the total budget?
Yeah, 7.9. 7.5 to 7.9.
Yeah, the increase is like less than 0.01%.
Yeah, it's 45 basis points.
Yep.
4.5%.
Yeah.
Is that agreeable?
I don't think it's gonna make a sizable difference in anything, so I'm not particularly worried about the 5,000.
Do we have, anywhere do we have this year's contract number, the year we're in, by towns?
Look
Yep.
them up.
Not on that version, but I can tell you.
Okay, what are they?
Hold on, I need to go back. There you go.
Can I borrow your computer for 1 second?
You want-
I promise not to mess it up.
Am I not doing
promise.
it right?
No, you're doing great. I just,
Sure.
this is something I usually do for myself, but I didn't.
That's left, this is yours. Yeah. They'll be down here, the ones that are on. Like, you want this.
This is current.
This is current, this is the,
I
like,
just
the
have to
year
give it
23,
against
24.
Courtney, are you guys looking at changing your rates for billing?
My next month, September, that's my project.
Okay.
To start evaluating them.
Yeah, because,
I don't know, I
I was
highlighted
maybe
it, go
interested
to
to
the
see
format and
what,
do it.
how successful the village is.
Oh,
at
you change
Yeah,
it?
we-
tax
It's,
money.
it's that number
For
over
the
this.
the billing. And I also think, like, for us, I know that we have historically tied, Ulysses has historically tied our rates to the village.
Yeah.
But we're going to have to, I'm gonna start doing a dive into, just because it's sustainability of putting on property taxes. And, our town attorney, works with the village of Aligo, and a few years ago, they got FedEx to actually provide them with the rates of different municipalities. And it took some doing, and FedEx was not super excited about doing it, it was public information. So they were able to push hard enough to actually get the rate, so it might be, so we want to see, we want to look at what's bearable and what other municipalities even outside the village are doing, so.
There are two moving parts to it. First of all, I mean, your rates unfortunately almost don't matter. Because the insurance companies have fixed
They
reimbursements.
tell you what you gotta pay.
Yeah, I mean, you could charge $10,000 a mile and you're gonna get 50 cents. So it's challenging. The second piece to it is just how billing looks in the future for us, of whether our reimbursement rate, if we're content with it with our current service. I have a feeling that if we went in-house with that clerk, that I would like to think that we will have a pretty significant increase in our capture rate. So there's a couple moving pieces to it, but the first one is reevaluating our current rates.
Well, it would be great if maybe we could have another meeting to talk about rates in particular.
Well, certainly.
Because I think that would be, I would also be interested to see what you're looking at from the variations in-house.
I think that would actually, so broadly, that would be a great plan, because traditionally, we've all done it separately. I think it would be nice if we had a cohesive plan to do that. I mean, I don't know, that we're all on exactly the same page.
No, but it'd be really helpful to know at least what page everybody's on, even if you don't want to join that page.
Caitlin, I'll get you the information of surrounding agencies as well.
That would be really helpful, thank you. That'd be really helpful.
So before, oh, excuse me, sorry, I'm distracted again. So I also wanted to bring up these contracts because I don't know that everyone remembers last year, but just to jog your memory quickly, we ran into a problem because Mecklenburg's call history, call volumes we had estimated in the beginning, so their overall budget cost went from, I forget what it was, maybe 35 to 90,000, I think, last year or something. Vaguely,
That sounds vaguely.
kind of insane.
That's such a big deal.
And so my ask last year was that we all sort of pitch in and decrease that number, because I know like Ulysses last year went down from the preceding year. I think Cobra stayed the same, and Village View went up last year, but it wasn't terrible. So my hope last year was that we all sort of pitch in to cushion that blow. So you can see, well, first of all, that didn't happen. The village did, so our number is artificially inflated, so that we could cut that from, you know, whatever, maybe it was 75 or 80. But anyway, we increased our number such that that number could go down. And I bring that up mostly to contextualize the increase and decrease numbers that you see there, right? So, like Ulysses, that number is high because your call volumes last year were low. So that's sort of a natural, just pendulum swing. But then the increase for Mecklenburg is really just sort of a return to what is the natural number. So we cushioned the initial blow, but unfortunately the hammer is still swinging, and here we are. But it is still a 25% increase, so I wanted to sort of reiterate the offer from last year to see if that's something we're on board with. I suspect if it wasn't on the table in last year, which was the best of times really for all of us probably, it's probably not this year, but just to throw it out there. Again, sorry, for feedback, the idea would be, do we want to decrease Mecklenburg's overall contract rate to cushion that jump? Which again is really just an artifact of having estimated their initial call volumes. I wanted to take that as a no.
Yeah, I mean, I think this is the year to just, the 23, 24 proposed numbers, which, if I'm reading that correctly, is based purely on the actual 3-year average of calls.
Yeah, it's returning to the true average.
I think this is the year to eat that.
Sure.
Because of the assessment changes. But as a parentheses to that, I want to make sure, I intend to do the math anyway, but I want to get some feedback from the towns if you all are okay with me, particularly because of the conversations that have only just been started with Enfield. I would like to see, and I've worked on it before and have not come up with a way that felt elegant enough to present in prime time, but I would like to return to looking at what we did with fire, where we have a fixed cost number. There isn't a way to directly apply that to EMS, but I've been wrestling with this for a couple of years. Is there a way for the village to come up with a number, which will be our problem to figure out, not yours. Is there a way to come up with a number of what it would cost the village to run one ambulance in the village only? And say, if some future board loses their mind and says, we're going to retreat to our borders and build a wall, and we're not going to service anyone outside the 1.2 square miles of the village of Trumansburg, what's that going to cost? If we did that, that'll give us a number. And then everything above that becomes something that needs to be split between the 3 towns by some formula that I have not been able to figure out. I would be open to a lot of feedback as to how to fairly distribute that. It's going to involve mileage, it's going to be, probably should involve type of call, which gets messy, but from there, we as a group would be able to say to an Enfield or a Newfield or whomever, well, we figured out what it costs each of our municipalities. Now we need to figure out what it's going to cost you, and if you can't handle the number, then you've got to figure something else out. But if you can't handle the number, then we provide it. I think that might be a way to get to that end result by kind of refiguring how we calculate our own, our budgeted relative to the three towns. So that's not for this budget year, but I'm interested in feedback and thoughts and the direction to go on that, possibly for the 24 or 25 budget years. Assuming that these numbers are going to go up, at least the total budget number is going to go up by 7 or 8% every year. Unless or until Albany says, here's your check, just pay, we'll pay for it.
So I want to add two quick things. One, the reason that those numbers were never ready for prime time is that it simply costs less to cover the village. There's no way to dice it, no way to figure it out that isn't just like a gigantic discount for the village and a huge increase for everyone else, right? We're closer. Yeah, I mean, it's the location of the station is in the village. The nature of the game is just that it's cheaper to cover. So how we overcome that hurdle is dicey. That said, I think I wanted to reiterate sort of the process of last year's budget and coming up with these numbers, and the reason that, you know, we basically just arbitrarily changed and lowered Mecklenburg's number and raised the villages. And just to reiterate that was, I think an opportunity for all of us to be altruistic, and sort of how we think about that in terms of moving forward, what our strategy looks like, as Roden said, in terms of, you know, when we're looking at including or expanding our boundaries, or how protectionist we want to be about the current arrangement of our district, and all of that. But I just wanted to sort of re-emphasize those two aspects, and I'll leave it there because I've talked quite a bit.
Well, I think it gets challenging because it's hard to be altruistic with taxpayer money. And when we're looking at increases, and I think it's wonderful we have such a professional department that there's demand, but it also deeply concerns me there were 11 calls in the city of Ithaca, because I really don't think we should be subsidizing the city of Ithaca. I mean,
Amen, I'm right with you.
I just, you know, I think Ithaca has made I personally think Ithaca has made its bet. And unfortunately, that I do see that has a trickle down effect, and then I imagine having somebody having a heart attack at 2 o'clock in the morning and you don't hear it, and you've got a rig in Ithaca. And then what happens?
100%.
I agree.
And so, you know, so it's challenging. I feel a lot more desire to be altruistic to Hector than I do to the city of Ithaca, because the city of Ithaca is not buying into services.
Exactly.
I wonder if there's even a way to, I would just throw out there that if the ambulance bill that you're pushing forward, and that sounds like I would be very supportive of. If Ithaca is really going, and I'm not saying that Ithaca would ever do this, but I would put the onus on the city to talk to the city about, you want us to help you out kind of thing. Not saying you don't go, otherwise they really should be contributing.
Really?
I agree.
Pitch money this way.
I think it's worth, I mean, if we're going to go down this road, it's worth pointing out that it's state mandated that we have mutual aid agreements. So we don't have a huge amount of choice, but we could send the city a bill. Whether that bill goes to the city, it gets dicey because Banks doesn't contract with the city, so we're not actually subsidizing anyone.
And I get that, but I also think it's worth having a conversation with the council members of the city of Ithaca to say, listen, you're putting a tremendous amount of pressure on us, and you need to start owning some of the problems in your own community. And so I'm not saying that I understand from mutual aid you can't make it, but it's like the fact that Cornell gives the city only $1 million a year is ridiculous, right? I mean, obviously they're using way more services than that, and it has an impact on the coffers when more than 50% of the city is in not-for-profit hands, is tax exempt. But, you know, it's just frustrating and concerning to me that you know, we're looking at subsidizing so far that we can't provide service to our own constituents. So I would love to help out Hector, but I have a whole lot less incentive or desire for Ulysses residents to be helping out Ulysses, or helping out the city. And I understand that there's not that, it's almost we're getting punished because you're so good.
Exactly.
Well, our mutual aid agreement is with banks, not the city, but that does raise an interesting point. So Ben used the word protectionist a second ago. There is, because of the mutual aid agreements, when I think part of our thought process collectively needs to be this. If there's a call in the town of Enfield, we have to go because of mutual aid. And it could be anyone, it could be Enfield, it could be Newfield, it could be somewhere to the north or the west. We have to go because of the mutual aid agreement. If we're approached by a municipality that says, hey, we're willing to pay for it, I think we need to figure out a way to get paid for it, because otherwise we're going for free. So if we have to go for free, but they say, well, we want to pay you, which of course means that we have to guarantee some level of service, I think we need to come around that and figure out how to be able to do that. Because getting paid to do something that you're going to do anyway for free is going to be a win for the group collaboratively. As for the city, I've had a couple of those conversations, and I'm sure you can imagine them. And not that any of you,
I'm sorry.
not that any of you in this room will get mad at me, but you're going to see more of me wandering outside my lane when it comes to some of these conversations. Because the city and the county right now, with the exception of DOER, Mike Steitley has been great. And there are a couple of Thomas County legislators who are very sympathetic to the stress on the system. But county administration right now and City of Ithaca, common council, with the exception of one or two of the council members, that's your problem. Go figure it out. We are not the cause of the stress on the system. None of our policies, reimagined or otherwise, are a part of the stress on the system, so you all got to find more staff. It's basically the response that I've been getting. So those conversations will continue. And, we got a holiday weekend coming up next weekend, so we'll see how busy it gets in the city. Whether we have to respond or not. We will if we have to. That's what the department is here for. But it's certainly not fair to, in particular, whatever the farthest end of our district, North Covert and southwestern Mech, not fair that if we take a call in the city of Ithaca and end up transporting to Sayre or Syracuse, it's going to be, 3.5 hours before that rig gets back in service.
Mm-hmm.
So the city doesn't have any contract for service for ambulances, so what happens if Bates walks out of the city of Ithaca and says, we're just not interested in doing business here anymore?
The city's screwed.
So the city doesn't have to have any,
EMS is not a mandated service in New York State. And that's part of the reason why rural communities get very nervous about unfunded mandates. I get it, but that's part of the carrot and the stick. The need to mandate for the service leads to the other pieces.
And the fact that we're covering for a for-profit company.
It is worth emphasizing that these are new changes. It's been decades of banks covering us. So it doesn't excuse the city as an entity of any culpability. I don't want to go down that road. But in terms of banks, the organization, it is worth emphasizing that it is a new development that this lopsided mutual aid, it really was, all of my time, and certainly before me, that it was really, I think it was 5 years ago maybe is when we hit the brink of sort of it was pretty even. But before that, it was hugely lopsided. I mean, they came here and they took over it all.
I was just shocked in general that banks didn't have a contract with the city, that the city paid them for certain services to even have coverage. That just shocked me.
I think I had this conversation the other night, actually. So I'm not mad at banks at all.
No,
if anybody
no.
watches on camera, the stress on Bangs' system is not of their own doing. I believe that at one time, Bangs administration did not want to contract with the city because they felt it would restrict them to an obligation primarily for the city relative to being able to respond outside of the city. Bangs wanted to make sure that they could take calls in Dryden, Lansing, Slater Road, Trumansburg, Ulysses. They wanted to make sure that they could go where they were needed and not be handcuffed to the city proper, which has been a great deal for the city for 50 years, frankly.
But when Trumansburg comes to a call and doesn't transport, there's no bill, correct?
Correct.
If Banks comes to a call and they provide service, they bill, right?
Correct.
So it's, yeah, they've been helping out, they've been helping us out, and I'm grateful that we have them. It's not it's a different model, so I'm not knocking that business. I don't blame them for doing that. But the difference is that when they helped us out, they got paid for it. And if we're helping out and not transporting, we aren't. We're paying for it, and the taxpayers in the city aren't subsidizing things.
I mean, something we looked at was last year. We looked at the number of calls we had that would potentially be billable that were not transports, and it wasn't a giant number. It's probably worth looking at again.
I think it's shifted a lot in the last year.
I think it's probably worth looking at again, because if we have, let's see, we have 269 calls, 62 mutual aid. So that number will be more now. But something like the city would be in that 62 mutual aid. If that number starts creeping towards 75 or 100, there's certainly going to be billable non-transports in there that might be worth capturing.
And the logic that they didn't have a contract, with the city because they didn't want to be handcuffed, but if there is a New York State mutual aid, they wouldn't have been handcuffed, right? They still would have had to go here, right?
For mutual aid,
Right. So they still would have to come.
I don't know if it's first or second call.
I'm not sure when the mutual aid requirement was put in place, so this may predate that. I honestly don't know the history well enough to answer. And it's also possible, I would imagine that if the city contracted with banks, they would have minimum thresholds for coverage, that type of requirement. So they, I mean, I can only guess, right? But
Because Bangs is a private service, they're not obligated to answer 911 calls as we are. So they could get a call in Brooktondale, I mean, if it wasn't their district, and turn it down. They can get a call in Trumansburg mutually for us, and they can turn it down. Because we're a public service, so we can't turn those calls down.
That is a muddy water, isn't it? That sucks. It's terrible.
The devil's always in those details, right?
Which I will say is a fear. There've been some good, I know Joel has, and I recently have had some good conversations with some folks at banks. There has been the fear that if they were to ever not be there, or if they were to ever sell, or if, one of these other one of these other for-profit agencies in central New York were to come in, that whole dynamic would change. There's definitely the banks.
Seems to me that might be inevitable down the line,
Maybe.
right? Because
but-
they're
but
considered small private, and a big company like, what, TLC
TLC, right?
or somebody could come in and just buy them out and say, here we are. And-
You need a willing seller. So I mean,
Right.
if the Bangs family, which has deep roots in the area, has done things that they didn't have to do, that would certainly change if it was a different entity.
Oh, absolutely.
So I think that relationship is one to maintain.
To go back to your, if someone's willing to pay, we should look into that, find a way to figure it out. It seems to me that, in the next 5 to 10 years, we're on a trajectory to having 2 crews anyhow. And if someone pushes us over that ledge a couple of years earlier, we're going to have to deal with that, but at the same time, that is an additional person helping, or entity helping spread the load. So I think it's hard to kind of game out all the different options and where it might go and what the state might do and what the county might do. But I'm definitely interested in this idea of how to create some sort of structure that helps to equitably handle what's likely up in front of us in the next 5 to 10 years, because it's not going to be pretty much any which way.
Well, that cost of expansion costs a set amount, right? It's like a water district. You run a line for a mile, it costs the same amount, really, whether or not you have 3 property owners or 50. So we need to a couple more customers to collectively
Right.
move on.
And I like that idea, that your idea there, yeah,
Hopefully sort
can we
that.
pool a couple of different
Yeah.
groups together
And
and,
if we go to 2 crews and they always gotta find, I hate to say it, gotta find bodies somewhere.
right, well, there's that too. But, you know, if we don't, I think that's a way that kind of puts us in the driver's seat in some ways, that like, if we're looking at this happening just amongst ourselves in the next 5 to 10 years, at least we can go out ahead and say, let's try and bring in a couple other people to shed this load and do it on our terms a little bit more.
Administrative costs won't go up that much. There are a lot of things that won't go up that much.
Right. Right, it's that first jump from 1 to 2 crews, it's gonna be the worst. I mean, 2 to 3 is not gonna be pretty, but it's only a 50% increase, right?
Yeah.
That's just
Just, this is how that works.
At that point, we're gonna be in public watching the video.
Hopefully.
So can I ask you a question about the, when did the adopted budget, because the email documents had only the proposed, and so when did the adopted budget, which is
That was,
lower?
that was what I just did. That was our last,
Oh, okay,
That's a good line.
yeah.
Okay.
He shows last year.
That was just so you could see the percent increase for each of your contracts.
got it. Oh, okay. Oh, so that's the adopted, oh, it's for you, it's the 22, 23, for us, okay, that's where I was,
Right. Yeah,
that's where I was getting confused.
It's-
We're in a village budget, got it.
Yeah, it is worth emphasizing maybe, that we're budgeting a year and a half ahead. So that's another reason for the volatility Gordon pointed out earlier in terms of up and downs.
Anything else, EMS? Questions, comments? The only other thing I'll mention is I am still walking around with my handout looking for money for a new facility. We did submit to Schumer and Gillibrand's office for $3 million as part of this year's federal budget cycle. We won't hear until September, assuming that they pass the budget on time. TCAT got $7.8 million, I found out today, for electric buses for one person to ride on.
20% cut in service?
And a 20% cut in service. So that would pay for our new fire and EMS building, which actually does transport people. But maybe I'll get the opportunity to share that snark with one of our senators at some point. Anything else? Questions, comments, concerns, contributions?
Had a meeting with, Joe Borst yesterday for Interlaken Fire.
Yep.
And we talked about South Side ambulance, and they got a new manager and a new billing thing, and they're solvent right now, so they might be around another year, which is good news.
Good news. Actually, I actually had an interesting conversation with North Seneca Ambulance as well, and it sounded like all of our fears that I think we've talked about every budget meeting for the last 10 years has been, what are we gonna do? South
Yeah,
Seneca
Seneca Mills, yeah.
And it turns out North Seneca has had the same conversations, and they actually have an expansion plan. So I think even if South Seneca disappeared tomorrow, our required expansion would be pretty minimal.
Yeah, I think North Seneca, South Seneca dove under there, North Seneca thought they could expand and
Yeah,
cover
they-
some of
yeah.
it. They talked about it already, but I don't know.
Yeah.
Well, they said South Seneca's doing all right now, so hopefully, they were supposed to be closed in September, so they survived that, and they're looking, they got a new guy in there, and they're new billing, and they're doing better, so
Good. That's very nice.
maybe they can survive.
Maybe they can do the 5 points of all of them. Billy to work in Ithaca. They drive that far. Can I grab
All right, well, if there isn't anything else,
the
thank
reserve
you all.
questions for you, from you?
Yep.
I got
Yeah, motion to adjourn.
You're talking about this